Hi, I am Dr. Raghav Malik, consultant, cataract, refractive, and cornea surgical sciences at Center for Sight. Today, I'll be discussing about why and how the pre-operative examination or the examination prior to your refractive surgery is very important. So, once you go in for refractive surgery, so let me tell you and let me be very clear that if 10 people are going in for an examination for refractive surgery, all will not be fit. Only 4 to 5 will be fit. 5 patients are actually on the verge of rejection because of multiple factors, right? So it is not that if you want to get a LASIK done, you are already qualified. There have to be a number of tests that have to be done, and only if your surgeon feels that all these tests are okay, only then you'll be cleared for surgery. Why? Because if there are any red flags in the pre-operative examination, there can be chances of damage or complications later on in life, and we don't want that, and so don't you. So that is why what we emphasize on is a very important and a thorough pre-operative examination. The pre-operative examination of any patient wanting to undergo refractive surgery is a battery of tests. When I say a battery of tests, that means about 15 to 20 tests, including your power, your spectacles, current power, the new power, then the thickness of your cornea, the curvature of your cornea, the dryness score, the retina score, a thorough slit lamp examination which looks like this. So on this particular machine, we can actually do a number of examinations to know how your eye health is. So in this particular video, I'll be talking about two such aspects. One is the cornea health and the second is the retina health. So if you look at this eye diagram, the cornea is just the front portion of the eye where the magic happens and where we will fire the laser to remove the power. And the retina is the inner part of the eye, also is synonymous to the brain of the eye, right? So just how our body has a brain and the brain is made up of a number of nerve fibers. Similarly, the retina is made up of a number of nerve fibers that connect and form the optic nerve that connects the eye to the brain, right? So we need to know that the retina as well as the cornea are healthy prior to the surgery. So now let's go into the details of it. So the cornea is a transparent structure through which the light actually goes and enters into the eye. If there is any problem in the cornea, then there can be more complications if we go ahead with the refractive surgery. So the cornea needs to be transparent. There should be no scars. There should be no active infection. There should be no weakening. So we do a particular scan known as a tomography or a pentacam scan, where we will see the thickness of the cornea, the curvature of the cornea, the front and the back portion, and the relationship between the front and the back portion. So all these scans seem very complicated, but in the blink of a second we can get results, and it gives us whether the cornea is healthy. So yes, if you do a refractive surgery on a weaker cornea, there can be chances of complications, something known as an ectasia, where the cornea becomes weaker with age. That can happen and that can lead to permanent damage. So very important to know that your cornea is healthy prior to surgery. Secondly, the retina. So what happens is that during the refractive surgical procedure, let's say this is the eye, we have to put a machine on the top of the eye so that it can hold on to the eye. So this machine creates a suction on the eye. Because of this suction, there can be certain damages onto the retina. That is why prior to the surgery, a thorough examination of this retina has to be done. We put drops inside the eye, dilate the eye and check the retina for any breaks or any weaknesses. If there are any breaks or weaknesses, they have to be treated prior to the surgery by doing a certain type of laser and making it better. And once this is healthier, then you can proceed with your refractive surgery. Very important to do a thorough pre-operative examination and know if there are any pre-existing weaknesses before you can go in for a surgery.
Follow Planet LASIK and post your queries to get answers from the experts.